General practice is busier than ever. While your surgery may have fewer people in the waiting room, a great deal of work is still going on. Patients are seeing many changes and advantages to the way they can access their primary care.
Before, you'd have the routine appointments for the doctors, and then you'd have an on-call doctor. So patients would come in, they'd see their GP, they'd go for their appointment. And generally, patients would stay a little bit longer, time would overrun, and GPs would often always be running late. Now, with the telephone processing, there is an on-call doctor and there's a triage doctor. And then if there is a medical need for a face-to-face appointment, the slots are there for the afternoon and they're brought in to see and assessed.
When you call your local doctors, reception teams will ask you directly what your health needs are. However, some people find it difficult to talk openly about problems that usually they would only be comfortable talking about with their doctor. But the reception staff are well trained and focused on helping you to receive the right care at the right time, which may not always mean seeing your GP.
We have 2 GPs every day, so that has not changed. But what we have changed is we have added an advanced nurse practitioner who does the triage in the morning, and also myself, a pharmacist prescriber. So we've increased the appointments and trying to take a bit of pressure off the GPs, and also we can all sign prescriptions in between. If a face-to-face is required, the patient is notified to come in for a face-to-face. We find out what time is available. We have those slots free in the afternoon. Once the acute triage is done in the morning, we focus on the econsults.
Using econsult, patients are getting to see the right person for their problem quicker. And they are able to do this in their own time, rather than waiting on the phone. Of course, not everyone can or is ready to use econsult. And you can always still get in touch by telephone or by visiting your doctors in person. But if those that can use econsult do, it can help to free up time for those who most urgently need to see a GP or one of their healthcare team, which could be an advanced nurse practitioner or a paramedic.
A nurse practitioner is a nurse, so I qualified as a nurse back in 2012, and since then I've done extra qualifications, so I can see and treat a number of different conditions independently of a doctor.
First contact paramedic, as it suggests, is somebody that you can book into your GP service and you can see them immediately in the way that you might see a nurse or a GP. But it's possible that we might have some other skills to bring to bear to the issue. So, for example, I would also go out and see people in community.
Across the UK, our general practices are growing their teams of dedicated health professionals to help you get to the right person at the right time. Look after your local healthcare team and help them to look after you.